My name is Patty Pickup. I'm 40 years old. I am a mother of 3 children. I have a 2.5-year-old and newborn twins who just turned 5 months.
My name is Cindy Stevenson, and I've been married to my husband Eugene for 33 years. We have two children, a son-in-law, a future daughter-in-law, and 4 grandchildren.
My name is Misty Beck, and I'm 31 years old. I'm from Rolla, Missouri, and I graduated in '99. And from there I went to SMSU and graduated from there in 2004. And I taught for 3 years, and I loved it. It was amazing. And basically I got married and got pregnant, moved back home to be by my mom and dad.
Cardiomyopathy during my pregnancy that was not diagnosed. It was confused with preeclampsia. And as the pregnancy went on, I started noticing towards the end of my pregnancy with my twins that I started having severe shortness of breath. I was having a real difficult time even just folding laundry, which is a pretty simple task. And then after the babies were born, started having some other symptoms of shortness of breath. I had a difficult time walking just to the bathroom. I had trouble getting in and out of bed because the swelling was getting so severe. And just things like that that could have been confused with delivering twins.
In May of 2010, I actually had a heart attack. So when I get to the emergency room, I'm sitting there, and then I have the attack again. And when it gets up to the jaw, and then I couldn't talk, and I just said, "It's not stopping." You know, it's I could know it wasn't going away. They gave me the nitro, and then after doing all the testing, I was sent to Barnes in St. Louis, and they were telling me that I need to go in for surgery right away. And when they got in, I had 95% blockage in a main artery, and then they had to balloon another artery and put 2 stents in the blockage. So I did fine for a year, and then in June of 2011 of this year, I went back in, and I was having pressure in the chest, or the area in my neck and chest area, and my ears were really a lot of pressure. And so I went in, and my cardiologist in St. Louis, Dr. Reese, he said, "I'm afraid we're going to have to go back in." And I was like, "Oh, wow," I'm really surprised. And so when they got back in, the artery that they ballooned, they had to stent that and then put another stent in around the scar tissue of the other artery. And so I was doing great. Once again, this time an unusual case because a lot of my symptoms and a lot of my heart problems don't show up on any tests that they do, no EKGs or stress tests or anything. And
it's been very difficult. I never had a heart issue prior to having my stroke. I went in to have my daughter in November of '09 and had normal C-section, fairly normal. And I left the hospital, and I immediately felt like pressure in my chest. And I went home, and I wasn't even home 24 hours. And I called my OB and said, "I can't breathe, what's going on?" And I was literally like gurgling when I would lay back. And I got to the hospital here in Rolla, and they pretty quickly admitted me and said my lungs were full of fluid. And from there they tried to stabilize me, and they couldn't stabilize me basically. And so they had to intubate me. When I was intubated, I aspirated, which causes more problems. But I was in the coma for a couple of weeks, and I actually got transferred to Missouri Baptist in St. Louis. When I first got to St. Louis, I coded for almost 7 minutes, and they think that's where a lot of the brain damage and stroke came in. They got me back, thank God, and I was in there for another 3 weeks. And when I woke up, all I could see was red for 2 days. It was like looking through a red lens or something, and I couldn't use my right side of my body. as soon as I woke up, I couldn't move it. So from there, I went to a physical therapy rehab for another 3 weeks and learned to walk again and kind of try to write and things like that again.
I had just come home from the hospital with the girls, and that following night, the shortness of breath had gotten really severe, and so we called the doctor. The doctor told me to go into the emergency room, that she thought I had developed something called cardiomyopathy. So whenever I went to the emergency room, they expedited me through rather quickly and let me know that I had congestive heart failure. I couldn't believe it. Once the doctor started talking, it just sounded like the Charlie Brown skit of all I kept hearing was congestive heart failure. And I was laying in the bed thinking, I'm 39 years old and I have congestive heart failure. What does that mean? The nurses on the floor were really good. The doctors that took care of me did a great job. And then, so the only support is really just the healthcare professionals of getting it treated, getting it all under control, and then support from my family, and having somebody there to help take care of the kids, because I was literally too weak to do that.
Support from my family and friends, my church family. My husband, of course, is my biggest supporter, and my daughter and son. But I know when I was in surgery the first time, and I know when the doctor came out and told my husband that, you know, this is the widowmaker, that a lot of women usually don't make it through this. And I think that really hit home to everyone. You know, and I feel, I know, so blessed, because I'm thinking now of all the signs that, you know, that God had given me to change my decision about the things that I should do, as calling, you know, my doctor instead of letting it go, and not ignoring my signs and symptoms and getting help for it. And so it's, as far as support from everyone, that helped me get back to how great I feel today.
My family is my biggest support. My parents are amazing. They are always there for me every day if I need anything, you know, and my husband is my biggest supporter. He has been there through, we've been together 15 years. He's been my rock, and he helps me get through every day. And my children are definitely my sunshine in my life. So they help me keep going every day.
Life with twins is crazy, and you add a toddler into the mix even more so. And then to be dealing with a heart condition and permanent heart damage that's never going to go away. At some point I'll be able to start exercising to help build everything back up. It's not very easy for me to do right now, not just because of my life and the craziness of it, but just because I still get short of breath doing just very minimal tasks. So,
After the first time that I went in, and you know, I was just so relieved that everything was, you know, everything, they found it in time, and that I was alive. You know, I was like, you know, big thing was dieting, exercising, and you know, just you know, living each day, because you know, you realize how short life can be. And after they went in the second time, I did the cardio rehab at the hospital, and the ladies there, the support that I received there is wonderful, because they encourage you and help you to you know, learn your diet and exercise and your routine, and try and get you into. And I know I'm almost finished with that, and now I'm thinking, okay, you know, I need to do something afterwards to keep going there. So.
And ever since then, it's been a struggle. I struggle every day trying to take care of my kids and be a good mommy and wife, and it's hard when you're sick every day. So just the heart medication and the other medications that I'm on makes me not feel well. You know, there's side effects to everything. So I wish I was doing better. I pray to God every day, and I have hope that I will get better. It's hard. It's very hard to be 31 and not be able to do a lot of things.
thought I knew a lot about health and healthcare. The biggest thing I can say is be your biggest advocate. If you feel that something is wrong, don't be quiet about it. Don't assume that you're making a big deal out of nothing, and don't let anybody make you feel that way. If you know something's wrong, you know your body better than anybody else. So my advice is really listen to your body, and if you know something is wrong, be persistent with your healthcare provider on helping you find out exactly what that is.
Heart prevention, watch your diet, watch your exercise, cholesterol, sodium. The other is not to ignore the signs or the symptoms.
You know, definitely stay on top of it. Check your blood pressure stats. You know, check with your cardiologist to see if there's anything, you know, when you have warning signs as far as pains going down your arm, shortness of breath, tight feeling in your lungs. My kids are amazing, and I love both of them, Layla and Cole. Both are definitely my rocks in life. They help me get through every day. You know, every day that I have to live like this, I look at them and I know it was worth it.